Dr. Cicero Coimbra earned his medical degree from the Federal University of Rio Grande do Sul in 1979 and holds specialist degrees in internal medicine and neurology. He completed a fellowship in pediatric neurology at the Jackson Memorial Hospital of the University of Miami and completed postdoctoral training at the University of Lund in Sweden. He was associate professor in the Department of Neurology and Neurosurgery and is the founding president of the Institute for Research and Treatment of Autoimmunity in Brazil. Dr. Coimbra's clinical work focuses on neurodegenerative and autoimmune diseases, and he currently seeks to deepen and share his knowledge about the causes of the worldwide exponential rise in the prevalence of autism spectrum disorder and other neurodevelopmental disorders.
I started treating autism in 2014. And the reason why I started treating children with ASD was because there were publications showing benefits of vitamin D in autism, and also papers showing that TH17 is active in children with autism. So we started using high doses of vitamin D in autism, and we got very good results. But then afterwards, at some point, I faced with this undeniable relationship with autism and the increasing number of vaccines that were giving to children. As you see here, in 1970, you had one child with autism for in 10,000 non-autistic children. So in 2018, you had like 1 in 36. Today in US, you have like 1 in 22. And in Brazil, it seems that we are having like 1 in 10 patients. This is a tragedy. So we started investigating what could be causing this sharp increase in the rate of autism. In order to do that, we had to use the method that was published in 1965 by a British epidemiologist. His name was Bradford Hill. And he published that a set of criteria that should be used to demonstrate that one factor is causing one disease. And thanks to that, he was able to prove that smoking was a cause of lung cancer. And since then, the criteria of causation of Bradford Hill is used in several other instances. So you could use to try to find out the cause of the explosion of autism. And according to those criteria, there is one criteria that is called the dose response criteria. So if, for instance, if smoking causes lung cancer, if I increase the number of cigarettes that I smoke per day, I will increase the risk of having lung cancer. This is dose response. I increase the dose, I will have an increased response. So if you want to find a factor that is causing autism, you have to find this factor that you are looking for has to follow the dose response criterion of Bradford Hill. In other words, you have to find something that is increasing, some toxic agent to which children are more and more exposed And the more you expose children to that factor, you increase the response, which is autism. It's like increasing the number of cigarettes in a certain population, smoked in a certain population, you would increase the response, which would be the lung cancer. So, looking for a factor like that, we have to realize that this factor should be applicable to all countries in the world, because the explosion of autism is happening everywhere. It's not something that is happening in Brazil. It's not something that is happening only in the US or in Britain or Australia or any other country. So it has to be some factor that is happening everywhere, that is occurring everywhere. So what has occurred everywhere in all countries is the increase of number of vaccines given to children. So this timeline goes from 1967 to 2012. And you see that by 1985, you had less than 70% of children given like 5 vaccines or 5 shots of vaccines. In the second half of the 80s, it was the period when the sunscreen appeared, and a lot of pressure, a lot of advertising to have, so that people should avoid any kind of solar exposure. And at the same time, they should be using sunscreen, sometimes even if you are under artificial light. So the level of vitamin D dropped suddenly here in the whole population. And when between 1989 and 1991, there was an outbreak of measles that killed a lot of children, much unusual as compared to previous years, when you had no limitations to expose yourself to sunlight. And as a consequence of that, you see that there were more and more and more vaccines. And as you increase the vaccines and the percentage of children covered with those vaccines, now you were having more vaccines and more than 90% of children vaccinated. When this was happening, the number of cases of autism also increased. So the increasing of vaccines could be preliminarily accepted as a possible cause of autism. But only that criterion does not prove that vaccines can cause autism. Yeah, you may remember that it was like 9 criteria. So you need another criteria, the criteria of mechanism. So if vaccines cause autism, then there should be a mechanism by which vaccines are causing autism. So in order to find that, you have to look at the composition of vaccines. And all those vaccines that you see here and you give to children have aluminum nanoparticles in their composition. The vaccine given to prevent to prevent the virus that causes cervical cancer infection from that virus. Also has aluminum salts. So then maybe you have a mechanism if you try to see if aluminum is toxic. So you go to Scholar Google, and you see that there are more than 2 million papers talking about or discussing about the toxicity of aluminum. Aluminum is toxic even to plants, not only to animals or human beings. So then now you have a mechanism that stretches the possibility that vaccines can be caused. Then you need a final, or what I consider to be a final proof that vaccines can really be accepted as a cause of autism. You have to find aluminum nanoparticles, because the type of aluminum that you inject in vaccines are nanoparticles of aluminum. It's not a soluble type of aluminum that you ingest when you drink water. When you drink water, you are ingesting soluble salt of aluminum. And less than 1%, I mean, like 0.25% of this aluminum salt that you ingest is absorbed. Only 0.25. And most of that aluminum that is absorbed is easily excreted, eliminated in the urine. That's not what happens when you inject aluminum nanoparticles. Aluminum nanoparticles are used in vaccines because they cause inflammation. And they had the antigens attached to those particles. So the immune cells phagocyte those particles, and that's the beginning of the process of producing antibodies. So if aluminum causes autism, then you have to find, and the aluminum of vaccines cause autism, then you have to find particles of aluminum in the brain tissue of children with autism or individuals with autism. And that was what these researchers from United Kingdom have done. They published this in 2018. They went to the University of Oxford, because the University of Oxford has a bank of brains. Perhaps for the last 70 years, any patient who died in the hospitals that were affiliated to Oxford University and died with a neurological disease of unknown cause, they had their brains fixed with formalin, removed, and stored in a bank of brains. So they went to that bank of brains, and they got samples of the brains of individuals that had died, not because of the diagnosis of autism, but with autism. And what they found is this: we can read individuals with a diagnosis of ASD have extraordinarily high levels of aluminum. This is the British way of call aluminum in their brain tissue. So you see what they found in their brains. They found particles of aluminum. within immune cells. This is a lymphocyte. This is a macrophage that has several nanoparticles of several particles of aluminum inside. So, to me, as a medical doctor, since I was graduated, I was taught to give the highest level of importance to what pathologists find in the microscope. They usually have the final word. They say, "Okay, I looked at the tissue and I found the bacteria that causes tuberculosis. So your patient has tuberculosis." And no one will ever discuss, argue. No one will ever argue against that statement, because it's like you saw the criminal in the scene of crime stabbing the victim, so to speak. So I have to give them the highest level of importance to this finding. So to me, it's quite clear that what is causing autism is the presence of aluminum in vaccines. And it's an absurd, because you could use other nanoparticles, like calcium phosphate nanoparticles, and reports about the effects of calcium phosphate nanoparticles is that they may cause even higher production of antibodies as compared to aluminum nanoparticles. So it's difficult to understand why, if this is being published everywhere in several papers, in several scientific papers, and the pharma company that produces vaccines continue using aluminum nanoparticles in their vaccines, in their products. So as I told you, the fate of these nanoparticles, are completely different from that you see regarding soluble salts of aluminum that you ingest. They are biopersistent. Yeah, maybe we can remember that figure that I showed you, demonstrating that a leukocyte can cross the blood-brain barrier carrying virus, and thereby they would infect the nervous system, and this is called the Trojan Horse mechanism. So if you imagine that this is not a viral particle, but actually an aluminum nanoparticle, you understand why and how the aluminum nanoparticles bypass this barrier and reach the nervous system, the brain, and why it is found as particles within immune cells, like you see here. So that's what I was telling you about. Aluminum causes inflammation, attracting immune cells to injection site. Aluminum nanoparticles contain antigens absorbed to their surfaces. They are phagocytized or engulfed by leukocyte, thereby triggering antibody synthesis. This is called adjuvant effect of nanoparticles. There is a chronic encephalitis associated with ASD, and this can be demonstrated by measuring the level of this enzyme called neuron-specific enolase, or NSE. Just like when the liver is inflamed, when there is a inflammatory process affecting the liver. The liver cells release their enzymes in the bloodstream. The same thing happens when you have an inflammatory process affecting the brain. The damaged neurons release this enzyme called neuron-specific enolase. Okay, the inflammation that is caused by the presence of aluminum nanoparticles breaks the blood-brain barrier, so that now it's toxins and microbes can have access to the brain tissue. And the adjuvant effect of aluminum nanoparticles induces antibody synthesis against the brain tissue. And this has been published. You see, neuron-specific enolase has been proposed as a biomarker of autism spectrum disorder. Many publications about that, more than 10,000 publications. Here you see 12,600 publications showing there's brain-specific autoantibodies in the plasma of subjects of individuals with subjects with autistic spectrum disorder. So this is also published. So if you try to combine everything that you know about the pathophysiology of ASD, everything is explained by the toxic effect of aluminum. Even the wide range of metabolic disorders that you find in children with aluminum in children with ASD. I'm sorry. Everything is explained on the basis of the toxic effects of aluminum nanoparticles. So ASD fulfills the criteria to be classified as an autoimmune inflammatory syndrome induced by adjuvants. The syndrome was first reported by Schoenfeld and Agmon-Levy in 2011. And they emphasized these factors entailing an immune adjuvant activity, such as infectious agents, silicone, aluminum salts, and others were associated with defined and non-defined immune-mediated diseases. So adjuvants can cause autoimmune diseases, can trigger autoimmune diseases. And that's exactly what is happening in the brains of children with ASD. They have an inflamed brain. Aluminum nanoparticles is within immune cells in their brain that are infiltrating their brain. And it's definitely ASIA syndrome. So it's important to emphasize the question, the issue about infections. Infectious agents can induce an autoimmune disorder, an autoimmune disease. And this is exactly what happens regarding the MMR vaccine, because I will talk about that in a moment. This slide shows that interleukin 17 is elevated in the serum of children with autism, just like in any other disease, any other autoimmune disease. So autism and vitamin D releases 27 more than 27,000 publications because vitamin D suppresses Th17 cytokine production. So looking at that picture produced by our own city, showing that pharmaceutical companies that produce vaccines cannot be sued due to a law that was approved in US in 1986, and a number of vaccines containing aluminum that is given simultaneously in a 2 months old baby. I cannot accept that as something that should be considered normal. So this slide shows that regarding the hepatitis B vaccine, the amount of aluminum that is given to a child in the first day of life is equivalent to the amount of aluminum present in 10 shots of the same vaccine given to a 70-kilogram adult person. And if you now go to a baby that is only 2 months old, and the baby receives this amount of aluminum per kilogram of body weight, and this is equivalent to 24 vaccines given in a single day to a 70-kilogram adult. This is not acceptable. Here you see the year of 1986 when this National Childhood Vaccine Injury Act was approved in the US. You see the number of shots that children were receiving in 1983, and in the number they were receiving in 2023, 76 shots. And now you see that it's in 2024, it was like 88 doses. So, moreover, it's important to say that during pregnancy, the flu vaccine, the tetanus, diphtheria, and pertussis vaccine, and the RSV vaccine containing aluminum nanoparticles is given to pregnant women and may cross the placental barrier and accumulate in the fetal brain. This has been demonstrated in experimental animals, and probably they cross the placental barrier using the same mechanism of Trojan Horse mechanism that is seen in the brain tissue. So that's it. If you have any other question, you can just ask me. The reason that I am trying to provide information about the role that aluminum nanoparticles are playing in the pathophysiology of ASD is quite clear to me. And we are facing an emergency. We could be using calcium phosphate nanoparticles that is even more effective as compared to aluminum nanoparticles in producing higher titers of antibodies. And I don't see any reason why you should not change the aluminum to calcium phosphate. In addition to that, it's quite clear to me that if you keep the level of vitamin D, circulating vitamin D, that we had in the beginning, up to the beginning of the 80s, children had up to the beginning of the 80s, most of those vaccines would be not necessary. We'd decrease the number of vaccines that are required to be given to young children.
Well, a final one, just similar topic, because there are some cases of autism that have potentially been treated with high dose vitamin D. Is that something that you've also treated? And is it addressing the aluminum toxicity in the brain, or, and this might be a whole other topic, but just a brief answer if you are aware of vitamin D reversing the effects of the aluminum toxicity.
There's high doses of vitamin D in children with autism because it's also an autoimmune disorder. You saw that there are high levels of auto antibodies against the brain. So we give high doses of vitamin D. That was the beginning of the treatment when we started treating those children in 2014. But now we also try to eliminate aluminum nanoparticles by giving silica. And we can see that the level of the concentration of aluminum increases in the urine and in the blood at the beginning of the treatment. Important to say that the concentration of aluminum that you have in the blood is 300 times less than the concentration that you have in the tissues, like in the brain. So the level of aluminum that you measure in the blood does not reflect what you have in the brain. And that's why when you start giving silica to those patients, you see that a first phase when aluminum in the blood increases, and the level of aluminum in the urine also increases. Then there is a second phase when the level of aluminum is decreasing in the blood, is still increased in the urine, and the final phase when you have undetectable levels of aluminum in the blood and in the urine. So this is a major point for us to address. We have to eliminate aluminum. There is something else that just came to my mind, and I think you would be interested to know about. When we started treating patients with ASD, at the same time, we were also treating young people with autoimmune disorders, like MS, for instance, like rheumatoid arthritis. And then we added to the protocol, because they were born after 1990. We added silica to the treatment, to the protocol. So this is a major addition to our protocol. We are trying to detoxify aluminum in all our patients. And we are amazed to see how much aluminum they are eliminating in the urine when you start giving silica. And this is something that will decrease the process of inflammation in all autoimmune disorders. So this is a major addition to the treatment. Last year, in the last 2 years, I would say, 2023, 2024, I was amazed to see, because I always ask about all diseases that occur in the family of patients. And I was amazed to see the number of young people and adolescents with severe depression. Severe depression. Nowadays, children, I would say, a 5-year, if you have a classroom with like 20 5-year-old children, most of them are taking antidepressive drugs at 5 years of age. This is unbelievable. This is really unbelievable. I had a case of a young lady that came with her mother. Her mother was an MS patient. And this patient at some point started getting worse and worse, with more and more difficulties related to her walking ability. And at some point in May 2023, she had an appointment, and she was requiring the support of a cane on the right side and the support of the arm of someone to be able to walk. So she was getting worse and worse during the previous 2 years. And I told her that all patients that I have, MS patients that I have, that are getting worse in spite of having high levels of vitamin D, patients with MS, all those patients that are getting worse, even taking high doses of vitamin D, adjusted according to the laboratory tests, pH level, all of those that were getting worse were having a very high level of stress. So I asked her, what's your level of stress? Because you are getting worse and worse during the last 2 years. And she said, in a scale from 0 to 10, her level of stress was 10. So I asked her, what was the reason for that? And she said it was because of her daughter. And I asked her what was happening with her daughter. And she said that her daughter was taking antidepressant drugs since she was 4 years old. And at some point in her adolescence, she started cutting herself, self-mutilation. And she had attempted suicide twice. So that patient told me that when her daughter was leaving to go to school, she would not be able to say for sure if she was coming back or not. So that was the reason of her high level of stress. So I asked the young lady to come in and ask her to try to stop that behavior, because her mother was getting worse. And she said that she would do everything that she could because she loved her mother very much. But I gave her silica because when she started when she started with depression, she was taking a large number of vaccines. Well, she came back 1 year later, and I could not recognize that young lady. She was completely different. She was well dressed. Her hair were well combed. I can't say that describe that. I did not recognize her. She was happy. She was smiling. and I asked her if she was how was her depression, and she said that she was 85% better, and her psychiatrist was decreasing the doses of medications that he had prescribed. She was taking 4 medications to keep her alive, and the psychiatrist was decreasing the doses of psychiatric drugs. So I asked her what was the reason why she was cutting herself, and she said something that we'll never forget. She said that she had to cause pain to herself to stop paying attention to the pain, psychological pain of having to live. That was the reason why she was causing pain to herself. But she was not doing that anymore, and she had plans for the future. So that was the first case. But then there were 2 more other cases, and the same result. So we are now seeing an epidemic of self-mutilations among adolescents and young adults. This is happening everywhere. We are seen an epidemic of suicide in several countries. So imagine what this is, the problem. There is a principle that was proposed more than 1,000 years ago, and it's considered to be the first principle of statistics, and says when several things are happening in the same place with the same persons, probably they have one single cause. This is called the principle of parsimony, and it's used in several, if not all sciences, including in the daily medical practice, to explain all symptoms, signs, and the laboratory abnormalities that you see in a patient, and explain with one single diagnosis. It's called the principle of parsimony. And if we apply the principle of parsimony to all things that we are seeing in our society, in several countries at the same time, autism, ASD, depression, we have to find one single explanation, and that's to me, that is the presence of aluminum nanoparticles in the brain, causing inflammation and causing all these diseases. I have seen increased enolase levels in children with ASD, with children with not only ASD, but hyperactivity disorder, attention deficit and hyperactivity disorder. They also have high levels of enolase, and this is not published, but I have seen in their laboratory results. So I hope that this information is helpful to you, because it's an amazing, it's a devastating pain when the parents lose a child because of suicide.
Yeah.
And they are jumping from apartments in big cities. They are hanging themselves in small cities. And this is happening in Brazil, and I think it's happening everywhere too. I have seen that it's happening in other countries. So you imagine the pain that this procedure is using aluminum nanoparticles in vaccines are causing. Okay.
Very important message to get out.
What?
It's a very important message to get out.
Thank you.
Something needs to change. Yeah.
Because it's difficult to deal with those mothers that have a child for those reasons. It's difficult to deal with the mother that brings her 16-year-old adolescent child and says, "Doctor, he depends on me to use the toilet. What will happen to my child when I die? Who is going to take care, as I take care now, of this child?" It's a lot of suffering, and so that's why I decided that I had to tell you this. It's important that this is properly investigated. Oh,
thank you very much for sharing.
Yes, and remember, you can stop that situation. You can stop the progression of depression just by giving silica supplements.
In any particular dose, or does that have to be dosed to a certain level as well?
Okay, so silica is a non-toxic substance.
Mm-hmm.
So you can give the largest dose that is advised, or even higher doses than that, and you will not have any toxicity symptoms of toxicity. I use one kind of silica that is called, maybe I will not pronounce that properly in English, but I will try. Okay. It's called in Portuguese monomethylcinenatriol. I don't know exactly how to pronounce that in English.
Maybe you could send it to me in writing and I can post it with this.
Okay. It's sold as a trade name of Silanox with an S, Silanox, and an X at the end. We use like 300 milligrams twice a day for adult people, and also for children who have at least 25 kilograms of body weight. In smaller children, I use half that amount. But there is no reported side effects. It's just a supplement of an important mineral, which is silicon, right? Silica, which is used in medicine to increase the production of collagens and collagen and reduce wrinkles. Mm. So it's completely free of side effects, and you see the amount of aluminum that is eliminated in the urine. So all adolescents that receive that amount of vaccines when they were small children, they should receive silica. They should be treated with silica for 1 year or more to eliminate all aluminum. They should not stop until aluminum is undetectable in the urine. Mm-hmm. And you probably will see similar results. It's difficult to find someone who doesn't know a family who, or have not heard of a family who did not had an adolescent who committed suicide or tried to commit suicide. Mm-hmm. So this is extremely dangerous and should be addressed as an emergency.
Mm-hmm. And it sounds like it's safe to take the silica along with the antidepressant medications if they're on them.
Yes, definitely. There's no side effect.
Okay, thank you for sharing that.